Welcome to Politics Unplugged. I'm Ann Trujillo, and right now from coast to coast, more than 830 people are being treated for the measles. According to the CDC, this outbreak has hit 23 states, including Colorado. In fact, Colorado has one of the lowest vaccination rates in the country. Now, our state legislature has haggled over this for months. Governor Jared Polis took on the issue, saying he believes in vaccinations. He vaccinated his own kids, but he was also adamant that people should be able to make a choice. So he signed an executive order he says will help increase access to childhood vaccinations. And as Denver 7's Ivan Rodriguez shows us, it starts with educational outreach.
It is now official.
After signing an executive order, Governor Polis has committed to increasing Colorado's vaccination rate.
Colorado has one of the lowest kindergarten vaccination rates in the country. We need to increase the vaccination rate and at the same time, of course, fully respect the decisions that parents make in their health care decisions.
Can I see your bracelet, sweetie?
Polis says his plan is a compromise between forcing parents to vaccinate their children and letting rates continue to fall.
In some instances, of course, parents are making an intentional choice about not immunizing their child. But there's many others where there's a barrier. Could be a geographic barrier, an economic barrier, a lack of access to a dependable health care provider that is standing in the way of parents wanting to immunize their children.
Vaccines are incredibly important to protect all kids from a number of diseases that can be easily prevented if a large enough percentage of the population are vaccinated.
Laura Luzietti is a pediatrician with Every Child Pediatrics. She says the governor's plan to increase the vaccination rate through educational outreach is a step in the right direction.
There are a lot of really inaccurate sources out there on the internet that really scare parents and give them the idea that they shouldn't vaccinate their kids, which is not true.
Polis says last year, more than 9,400 children were treated for vaccine-preventable illnesses like measles, mumps, and rubella, costing a total of $55 million in medical costs.
The biggest fear we have right now is with the measles outbreak, and we've only had one recent case in Colorado, so we've been lucky so far, but we know with our immunization rates being how they are, we are at risk for an outbreak in Colorado.
And the governor says he wants a report on progress on this project next June and then every 6 months.